Hello and welcome to My Child First podcast. I'm your host Divya, and all this week we are talking about doulas. 22nd to 28th March is the World Doula Week, and this is something that we are bringing awareness of for everybody. Today with me I have Neha Misra. She's a doula in Delhi, and we have some questions for her. So Neha, welcome to the show.
Thank you. Thank you very much for inviting me. It's my pleasure.
Neha, right off the bat, tell me, when somebody asks you what is a doula or what does a doula do, how do you answer that?
So, a doula is basically a companion who is there to support you through your birth experience, which means that we interact a couple of times prenatally, get to know each other. I listen to what you have on your mind, what your experience of conception and pregnancy have been so far, what your fears are, what your concerns are, what kind of a birth you would like to have, and we get to know each other, we feel comfortable with each other, and then I'm there with you through your labor and birth experience. I'm there to support you, to help you to cope with the intensity of labor, to be able to integrate what's going on, understand what information you've received, help you to make informed choices for your birth, and offer that kind of a space for you to feel comfortable and safe in, and so that you have a positive birth experience. And I'm also there for you after you're born, initially for a few hours, to help you to initiate breastfeeding with your baby. And even after that, if there is support that you need, if there's anything you need to talk about to integrate your birth experience, to support to in the postpartum period. So yeah, I'm like that friend who understands and believes in birth, and who believes in you, and who is there to encourage you and stay by your side through your birthing experience.
Okay, so tell me a little bit about how many clients do you accept during a month, and how soon would you like your clients to contact you? Is there a fixed time or are you flexible?
So besides being a doula, I'm also a full-time mother, and I have 2 young kids. And so I chose also to do this work because I want to have time with my children. I would like to do not more than about 3 births a month. Because when I commit myself for a birth, I am on call for you starting from -2 weeks of your due date to up to 2 weeks after your due date. That's the time when you can go into labor at any time. And we also have multiple prenatal meetings. However, I am hoping to be able to offer support to more people with a team of doulas. So I have with me a colleague who works with me as a backup doula. So in that case, we together would probably be able to support more women.
So when you say all these prenatal meetings, I heard you say them many times, is birth plans something that is discussed in these meetings?
Yes, that is a very important part of our discussions in the prenatal meetings. However, I don't really like to call it a birth plan, but prefer to call it birth preferences. The nature of birth is such that you can't really plan it too much. You do often have unexpected situations to face. However, it's really important to think about what your preferences are. And that is not a process of Googling birth plans, what some people feel they need to do. But it's more about thinking about how you would like your birth to be, what you feel are the things that will support you to have the kind of birth that you want. Talking about that and writing that down, putting it down as like just a one-pager sort of a summary for which you can then share with your care provider and your birth team, so that everyone knows what your expectations from your birth are and what your preferences are. So yes, that's a very important part of our prenatal discussions, and the birth preferences are different for everyone depending on who they are and what they want.
Okay, so I know that you practice in and around Delhi, and do you have like a list? Do you give specific referrals, or what do you suggest to parents who call you and say we're looking for a natural birth? What would you suggest?
So yes, there are a lot of people who would call up and say that they're looking to have a natural birth, and who do you refer, which doctors can we go to, or which hospitals that they can go to. And what I strongly believe, and which is what I also tell them, is that there are no best doctors or best hospitals list. Really, there are a lot of good doctors, and the important thing is to find someone who is right for you, someone whose philosophy of birthing matches yours, someone who makes you feel comfortable, who listens to you and respects your wishes. And it is, while I may have a few names of doctors or hospitals where where my clients have had good experiences, that is for them, that was their experience. And it's important for you to be able to meet at least 2-3 doctors, and then choose someone who seems right for you. I've seen that, there are broadly 2 different approaches to birth, and you need to find the doctor who matches yours. So there is one set of people who believe that birth is something that happens outside of you, and women need support during birth, and women need support to be able to cope with pain, and need intervention to be able to birth safely. And there is another school of thought which says that women are capable, and birth happens naturally as long as we are there to understand that and support that. And so depending on what your view of birth is, you need to find a care provider who sees birth in the same way as you. And therefore, and different doctors work for different people. The same doctor who was amazing for someone, there are some people who go there and don't feel comfortable for whatever reason with that doctor. So that's an effort that you have to make, and I can help you with questions that you can ask them, and that will help you to make a better choice. But I definitely do not decide who is the right doctor for you.
Okay. So, Neha, we say that we support women, but we also understand that support cannot be defined by us, and that our training teaches us positions and comfort measures and a whole lot of information about hospital procedures, and somehow people start to see us as experts. What would you say to either agree or change that point of view, whichever way you feel works for you?
I think that the expert culture, if you have to call it that, is a big problem that affects women's confidence in birth, because the way the system mostly is, it's that there are all of these people who are experts and who are going to teach you how to give birth. So you feel that you need to join a particular prenatal exercise class because they will teach you how to have a natural birth, or you need to go for a natural birth class that will teach you how to have a natural birth, and and the doctor will help you to have a normal delivery. But I strongly disagree, because I truly believe that women are capable, and it is not about teaching women how to give birth, but helping them to realize that, helping them to remove the obstacles that would come in the way of birth, which could be physical or emotional. And that happens with support. When you acknowledge that someone is capable, they realize it, they see it for themselves, and they feel confident. Their self-confidence comes in play, and that is what support means.
Yes, and that is what support means. Thank you, Neha. That was very informative. We also have on call with us Sanam Motwani Manchanda from Mumbai, and we're going to ask her a few questions today.
So, hi Sanam, how are you?
Hi, Divya. I'm good. How are you?
Very well. Okay, Sanam, I'd like to start with telling our listeners, or you telling our listeners, who is a doula and what does she do?
Okay, so basically, Divya, as you know, doula is a person who comes in as a support to any mummy who's having her baby to try and uh, support her to have a beautiful and memorable birthing experience. Doulas are non-medical professionals, so they normally help with support like breathing and massages and different labor positions. And informational as well as physical and mental support for a mummy as well as a family during labor and birth.
Okay, and so tell me how long you've been practicing and give me a little bit of a format of your practice. Do you do prenatals? How long are you there? Do you meet postnatally? Just for our listeners to know what is
Sure.
available in Mumbai.
Sure. So I started New Beginnings in 2011, and I am a certified labor doula, a childbirth educator, lactation consultant as well. So normally when any mama gets in touch with me, I try to meet them as soon as possible, in the early months of their pregnancy, just so that I can guide them in the correct manner and they have enough time to practice the things and research and understand the things that we've spoken about. So as a doula, I meet them during their pregnancy to increase a bonding between the two of us, as I'm going to be there with them for a very special time in their lives. So it's extremely important for me to meet them in advance and spend time with them, understand their expectations out of their birth, out of me. So I spend a lot of time with my mamas during pregnancy, and then once their labor does begin, I join them either at the house or at the hospital, depending on whichever is more convenient for them. Uh, from that point onwards, I'm with them all throughout until the bachu is born. So throughout this time, I'm trying to support them with different techniques that I've learned over the years of being a doula. um, Post that, we also work because I'm a lactation consultant. I also try to work with mamas to make sure that they get skin to skin and immediate breastfeeding with the baby within the first 1 hour of birth.
Tell me, how
Yes,
is it to work with doctors and hospitals? And do you feel welcome everywhere or a few places? You don't have to name the names, but
sure.
we know that there are different kind of people, there are different kind of hospitals, there are different kind of doctors. Everybody has their own way of practicing. So, what has been your experience in Mumbai?
Of course. So, unfortunately, as you said, it's been a kind of it's been a very big challenge from the very beginning. Initially, when I had just started in 2011, it was a much bigger challenge because not many people understood what a doula is. Nobody knew the concept. Hospitals were not giving permission, and more so over the families had no idea that something as a doula, known as a doula, exists in Mumbai. So it took me a while. It took me a couple of years of, going from pillar to post, talking to a lot of mamas about it, involving a lot of other birth professionals as well. And slowly but steadily now, people have understood the importance of natural birthing, which is how they now realize the importance of having a doula for their birth. So, as of now, I try my level best to educate mamas as well as doctors on the importance of this kind of birthing. But sometimes, yes, in Bombay, it is a challenge taking into account the number of interventions which are used in our hospitals. But there are also a lot of hospitals and birthing centers who are pro natural birthing in today's day and age in Mumbai. So mamas can get in touch with them and have a beautiful birthing experience.
So we can say that you paved the way a little bit for moms to have better births by not just supporting them yourself, but also creating an environment and educating. That's wonderful to
Yes,
hear.
yes.
Now I know
Thank you.
that it's a challenging job. Yeah, I know it's a challenging job, and I know that it's hard. And tell me, how many clients would you take in a month, which you would think is healthy even for you? Because I'm sure it's quite exhausting, and also that you do have family. So how many
Yes, yes.
and how soon would you like your clients to get in touch with you?
So normally through New Beginnings, I only take max to max 4 deliveries a month because I'm the only working doula as of now. If I do have a backup for the month, then yes, along with my backup doula, we can help many more mamas. But physically, it's difficult for me to be at all places at once. So right now, I take only 4 deliveries a month, just to avoid clashes. Because once you've given a mama that commitment that you're going to be there for her birth, you don't want to clash and not be there. So I think as more and more doulas come about in Bombay, we'll be able to take a lot many more births, together as a collaborative effort.
Right. And what is your preference that people should come you in their second trimester, in their third trimester? Do you take mamas who are really close to their birth? Do you have a preference?
No, I mean, I'm here for mamas at whatever stage of their pregnancy that they contact me. I have mamas coming in their first trimester. I have mamas coming in few days before their due date, which is okay. Uh, Sooner the better, obviously. But we're here to support mamas at whatever stage of pregnancy that they come in. If they come in sooner, it's always nicer because our bonding increases. Their doubts are cleared. There's a lot more support from our end as well. So mamas find it a lot more comfortable through pregnancy.
Right. Right. I think that is really valuable information for our listeners. Thank you, Sanam.
Today we got a chance to hear from Neha Misra and Sanam Manchanda. And stay with us on My Child First podcast all this week, celebrating the World Doula Week. Bye bye.